Welcome to the module on first aid and Lyme disease. I'm Markus Wesaw. I'll be your instructor for this particular segment. My contact information is listed on the screen, so if you have any questions, feel free to contact me about anything regarding this course. Let's go over the first aid and Lyme disease objectives. There are only 3, so we'll keep this lesson short and sweet. Firstly, I want to show you how to prevent Lyme disease, give you the basic information about Lyme disease and what to do if you believe you were bitten by a tick or know you were bitten by a tick. So, prevention of Lyme disease. Avoid tick habitats like grassy, brushy areas. Ticks are found in almost every state, every region, but that's where they love to be. Remove all leaves and tall grass wherever necessary, unless you have to work in that area because that's your ordinary job duty. Apply tick-toxic chemicals to your surrounding work areas. I like to use off just as a preventative measure. I think they have some other brands too, Deep Woods and off and all kinds of different toxic chemicals that you can use to repel and discourage ticks from getting on you. Wear light-colored clothing is a good way to kind of detect ticks if you're going to be out in the outdoors areas, and wearing long sleeve shirts are good too, and always tuck pants into your boots or into socks. It looks ridiculous, but in some regions of the country ticks carry Lyme disease, and it's very, very serious. And wearing a hat, showering after exposure, and doing a complete body check after you've been out in a grassy or brushy area is always a good idea. The basic information about Lyme disease. Lyme disease is caused by a bacteria in the gut of a tick, and they slowly feed and can transmit the disease during this time. A lot of people think that you can feel them crawling on you, and it's kind of not true. Sometimes you can feel a tick crawling on you, but most of the time you can't. It's very interesting. They're very sneaky and elusive critters. A bite can actually cause a rash that looks like a bullseye, and so just to give you an idea, you can see here in the middle we have a couple of photographs there that depict that bullseye effect. And so going back to this basic information screen here. Diagnosis is best done by a doctor and a blood who's going to take a blood test to determine that. And if you do get Lyme disease, they do treat it with antibiotics. So it's something that you can take care of, but it's best if you just try to implement every measure possible to prevent ticks from getting onto your body. There are quite a few risky areas in the country. So what I've done here is we have a map of the different regions across the country that have a good deal of ticks. And you'll notice in New England, the New England states, and then lots of parts of New York and Pennsylvania and New Jersey all have a very high concentration of ticks. So the Center for Disease Control actually considers these areas to be a very, very high risk. And other parts of the country have a moderate risk to low risk. The Midwest seems to be minimal or no risk, and then the West Coast up and down Washington, Oregon, California seems to have a pretty low risk. And in Texas, Oklahoma, all the way over to North Carolina, South Carolina, Florida, Georgia, Alabama, Arkansas seem to have a low to moderate risk as well. So unless you are, in the Midwest, like Wyoming or Montana, Idaho, Colorado, North Dakota, South Dakota, Kansas, those areas tend to be a little bit safer in the tick department, but I'm sure they probably have some other hazards in those states. So if you have been bitten by a tick, remove the tick from your skin using a pair of tweezers. And remember that the heads can be tricky, and sometimes they'll try to burrow in there and the head will disconnect from the body inside your skin, and that can actually exacerbate the situation. One thing that surprised me the first time that I had to do this myself was how good of a grip a tick actually has in your skin. And so they can really have a good grip in there, and it can be quite a struggle removing them, even with a good set of tweezers. So be aware of that. And what I like to do is I always like to put a band-aid on a tick bite. I know that sounds a little weird, but they can scab up pretty good, and it doesn't look like much when you remove the tick from your skin, but they can leave quite a little sore. And so if you're in one of the high-risk areas, again, I'll put that chart back up. If you're in, New England or New York, New Jersey, Connecticut, any place up in the Northeast, or New York, New Jersey, Pennsylvania, and even down in the South, it looks like from North Carolina down to Florida, over to eastern Texas, and a good deal of Oklahoma. If you go over in that area, it is suggested that you put the tick in a bag and take it to the doctor. But that's your call, depending on what you think is appropriate. And what we suggest, and this is according to both OSHA and the American Red Cross, they have a suggestion that you bring the tick in a bag and take it to the doctor so they can test it. But they can run other tests to determine if you have been bitten by a tick that has Lyme disease as well. So just so everyone's clear, a lot of people do work outdoors for their normal work duties, and they do have to go and work in grassy, brushy areas. It's very common in oil field work and petrochemical industries for people to work outside, as well as construction and a wide array of other different vocations. And so what we try to do is we're trying to prevent Lyme disease and make everyone aware of the initiative by the American Red Cross and OSHA in order to prevent as many people as possible from contracting Lyme disease from those nasty, dirty little critters called ticks. And if you want more information about this or have any other questions, feel free to contact me at your discretion. Have a great day.